We love seeing so many folks joining us today on such an important topic. Thank you again for participating and joining the webinar. Well, all right, it is 12 o'clock and we're going to go ahead and get started. Hello, everyone, and welcome to today's webinar on elder abuse and dementia awareness. My name is Mattia Zafar, and I'm the project specialist for the Healthy Brain LA team with the LA County Department of Workforce Development, Aging and Community Services, and the Department of Public Health. We're excited to bring you today's webinar made possible by the Healthy Brain Initiative Los Angeles, a 2-year initiative funded by the California Department of Public Health. Before we get started, I wanted to review some housekeeping items for our viewers on Zoom and Facebook Live. This presentation is being recorded and all attendees are muted. A link to today's webinar will be sent out to the email you registered with on Zoom and through the Facebook event page. Feel free to comment or ask questions throughout the presentation using the chat box on Facebook and the Q&A box on Zoom. And we will answer all questions at the end. For any technical assistance, please put your information in the chat and we will attempt to contact you. Now, without further ado, I'd like to introduce you to our host today, Sandra O'Neill. Sandra O'Neill is the news anchor for Telemundo 52's award-winning weekday morning newscast, Noticiero Telemundo 52. O'Neill is a seasoned journalist with nearly 2 decades of storytelling experience, covering issues and significant events impacting the community. Her storytelling has earned her notable recognitions from the Associated Press Television and Radio Association, an Edward R. Murrow Award for Production, and 3 Emmy Awards. We are thrilled to have Sandra host our webinar today. Please welcome Sandra O'Neill.
Thank you, Mattia. Thank you very much for allowing me to be here today and to welcome you to this seminar. It is very important for Telemundo 52 to be a part of this great initiative, especially because we ourselves do a lot of stories regarding the elder and regarding communities of Latino family members taking care of their senior citizens and their loved ones. And so this means a lot to us, and I thank you for the invitation. Of course, it also is important to bring access and services to the community members that's so much needed. And in fact, tomorrow in Telemundo 52, in our En Tu Vecindario segment, which airs daily, it airs on Thursdays, but we put it online daily. You will be able to meet one of these families, Marlon, who takes care of his father, Daniel, and he has used some of the services that the LA County Public Department of Workforce Development, Aging and Community Services provides, LA Found, and that's just one of many services that the department is offering these families. And I would like to welcome you to the seminar, but I also would like to welcome the leader of many of these causes. Obviously, we're talking about our new Executive Director of Aging and Community Services, Dr. Laura Trejo. She's here with us and she will be talking to us about some of those very valuable initiatives that the Department of Aging has for our community members of Latino heritage. Dr. Laura Trejo joined the department recently, and she has already been making a difference. Thank you very much, Ms. Laura Trejo, for the interview you recently gave Telemundo 52 regarding the many services. I think a lot of our community members need to know that they're there, that they're here for us to take advantage of. And I know you mentioned it in the interview we will air tomorrow. 211 has become one of the very wonderful, herramientas, tools that our community in the Latino families have to get part of these services, as well as the internet. And so I welcome you, Dr. Laura Trejo. If you can please share some of your experiences with us so our families can have a better idea of the services that your department offers. Welcome.
Good afternoon, everybody. Thank you so much. I really appreciate that lovely introduction, Sandra. Thank you for making time for us today, everybody. We really want to thank you for joining us today on such an important event. My name is Dr. Laura Trejo, and I'm the new Executive Director of the Aging and Community Services branch of the Department of Workforce Development, Aging and Community Services of Los Angeles County. That's a mouthful, and soon to be an independent Department of Aging and Disabilities starting July 1. Today's webinar is brought to you, as you heard, in collaboration with the Healthy Brain Initiative of Los Angeles County, which is led by the Department of Public Health, and it's funded by the California Department of Public Health. I want to extend my deep appreciation to all of our partners for all their incredible support and work that they do in helping us make this webinar possible today. As we all know, elder abuse is an important problem in our society, and it robs older adults of their dignity, their security, and in some instances, it can also cost them their lives. So this is a very serious matter for us to discuss today. Approximately 1 in 10 Americans over the age of 60 have experienced some form of abuse. People with dementia are at greater risk of elder abuse than those without. Therefore, it is critical that we take proactive measures and know how to recognize the signs of abuse in this vulnerable population. Your county agencies are committed to creating safe havens for elders in Los Angeles County. We need to ensure that our diverse communities are encouraged to report cases of suspected elder abuse or neglect, which will help us prevent and address elder mistreatment. A just society means recognizing that all people are equal, no matter how old you are, no matter how much income you have, no matter where you live. In order for us to live in a just society, it requires that we all be treated equally in our communities and that we live safely. Living up to our beliefs and treating everyone equally requires that we change how our society thinks about older adults and how to keep them safe. I want to take a moment to thank the Board of Supervisors for their incredible dedication and their support to keeping elders safe in Los Angeles County. I want to ask all of you, as you're here, make that commitment that we are creating better communities for all ages, but we must ensure that those people that are the most vulnerable are treated well and stay safe. Thank you for making time for us today. Sandra, back to you.
Yes, thank you very much, Dr. Laura Trejo, for everything that you're doing, that your department is doing. Obviously, it is very, very important to learn how to identify any possible abuse or negligence that a loved one is going through. And it's very important to report it, obviously. And so thank you for those words. And we also want to remind you that this is a participation-based forum. You will be able to ask questions, and we will also like to know some of the answers to our poll questions. You are able to participate just by picking one of the next following answers to these poll questions. And the first one that we would like to read to you has to do with, and you can just pick yes or no into one of these questions. The first one is, do you live or know someone that currently lives with dementia? You can pick yes or no. And do you have prior knowledge of what elder abuse is and what it looks like? These are some of the poll questions that we want to give you a couple of minutes to respond to. It is very important that we obviously have these tools to learn more about these padecimientos, like we call them in Spanish, some of these diseases that come, and unfortunately, if I go untreated, they can get worse, as we have seen in some of the family members' testimonies that we have been able to meet throughout the years. So this is one of the polls that you can answer, yes or no. Do you live with or know someone that currently lives with dementia? And do you have prior knowledge of what elder abuse is and what it looks like? Thank you very much for participating. And in fact, you can also ask questions for our panelists in our chat area. You can type the question and then we will be able to will be able to answer those for us. Moving forward with our program, I would like to introduce our next panelist, our next guest. And our first presenter is Jean Galliana. As an older system coordinator for the Los Angeles Homeless Services Authority, Jean is dedicated to improving systems of prevention and housing for older adults who are at risk or are currently homeless. Jean is passionate about dementia and their caregivers because her mom lived with dementia until it eventually took her life. Let's welcome Jean Galliana, who is with us today. Welcome, Ms. Jean.
Thank you so much, Sandra, and thank you for having me today. So today, I'm excited to share with you about dementia. My position, as you know already, is I work at Los Angeles Homeless Services Authority, working to improve systems for older adults, and many of them are living with dementia. So today, we'll just cover a couple of basic topics. What's dementia and Alzheimer's disease? How does elder abuse affect an individual with dementia? And how to advocate for a loved one living with dementia, and the importance of getting a memory evaluation. So dementia is a syndrome that causes deterioration in cognitive function beyond that which one would think of as normal aging. Like I'm starting to lose my keys all the time. That's pretty normal. And there are many other aging changes in our function, in our cognition. A lot of older adults have a bad back, or maybe they broke their ankle when they were tennis players in college and now they have a limp. So there are many things that happen to older adults that are normal, both cognitively and functionally, but dementia is a whole different thing. Of the different forms of dementia, Alzheimer's disease is by far the most common, and it accounts for 60 to 70% of all dementia cases. Dementia is still a large issue around the world. Right now, 55 million people are living with dementia. Dementia also is the 7th leading cause of death among all diseases and one of the major causes of disability and dependency for older adults around the world. And dementia has a physical, psychological, social, and economic impacts, not only for the people who are living with dementia, but also for their caregivers, their families, and societies at large. Over here on the right, I've got some symptoms, not every symptom of dementia, including cognitive changes such as memory loss, which is usually noted by someone else and oftentimes not claimed by the person living with dementia. Difficulty in communicating or finding words, difficulty with visual and spatial abilities, such as going up and down stairs. Someone might not see that there actually is a drop. And other issues like that, and also getting lost while driving. That geolocation is a really common early indicator. Also, people living with dementia have difficulty reasoning or problem solving. So a complex discussion is not something they can engage in at that point. They have difficulty handling complex tasks. I remember my mom could not remember how to put her makeup on at all. Something she did her whole life. They have difficulty in planning and organizing, and difficulty with coordination and motor functions. I remember one of the common issues I learned about when my mom was living with dementia is so many people with dementia can't put their seatbelt on anymore. The seatbelt that they've put on their whole life. And obviously other motor functions, but that one's quite common. And confusion or disorientation. So the psychological changes include personality changes, depression, anxiety, inappropriate behaviors, paranoia, agitation, hallucinations. So it's a very complex disease that comes with so many challenges and so many symptoms. So now we'll talk about elder abuse and dementia. And as Dr. Trejo noted, elder abuse is more prevalent in people who are living with dementia, which is why it's such an important conversation today. There are various forms of elder abuse. They include financial, physical, psychological, abduction, abandonment, isolation, and self-neglect. Self-neglect is a really important topic. Sometimes it can just go unnoticed, but it's something people should make every attempt to discover. Its rate prevalence in the general older adult population is 20% on average. Studies vary, but on average it's 20%, but which means 1 in 5. But people who are living with dementia experience higher rates of self-neglect. So we're talking probably 1 in 4 or 1 in 5 older adults who are living with dementia are engaged in some level of self-neglect. So as many as 1 in 10 older adults and 1 and 2 people living with dementia are victims of elder abuse. That goes from, if you're not living with dementia, your rate of elder abuse is 10%. If you are living with dementia, that rate escalates to 50%. For every reported case of elder abuse, there are 23 that go unreported. So family members, loved ones, and caregivers represent 70 to 90% of the perpetrators of elder abuse. And reporting helps link families to supportive services, both for themselves with their utter potential overwhelm and frustration, and how to mitigate their own behaviors and frustrations and seek the help they need, but also for the person who's being abused. So victims of elder abuse are 2 times more likely than to be hospitalized than other seniors. And we know that one of the worst places for someone who's living with dementia is the hospital. It's a very challenging place for someone who cannot negotiate all the changes from place to place, new people coming and going, all the loud sounds. It's just not a place for people living with dementia. And many over time in a hospital will experience further cognitive decline that they often will not recover from when they leave the hospital. So mandated reporters, they must report actual or suspected abuse. And very likely, most if not everybody on this webinar is a mandated reporter. A mandated reporter includes any person, paid or unpaid, who's assumed full or intermittent responsibility for the care or custody of an elder or a dependent adult, including health practitioners. So it's good to know that there are opportunities for advocacy for your friends or family who are living with dementia. As we know, oftentimes people who are living with dementia cannot communicate in the way that we like to communicate verbally. They may communicate through their behaviors, which sometimes might be frustration because people aren't understanding what they're trying to say. But the beauty of advocacy is you as a caregiver or a family member likely know the wishes and the likes and dislikes of the person living with dementia. For instance, some people who are living with dementia, before they got dementia, they like to sleep in. They like to sleep till 10 or 11. They don't want to get up at 7 when everybody else at the assisted living is getting up. So you could say, well, you know, I've always liked to sleep in. Maybe my mom will be happier if you let her sleep later, or certain types of foods and when and how to shower. So all those are really important personal likes and dislikes that can be shared with the care team, whether it be another family member, someone in memory care, or a caregiver that's hired in your home. And it's really important because we have to remember that people who are living with dementia are still individuals. They are different one from the other. And the best thing we can do is to advocate for them as we know them. It's also amazing for everyone to know that we have 2 great agencies in Los Angeles that can support both caregivers and people living with dementia. There are programs, resources, and wonderful case managers who are out there to support you. They're both on this slide, but the first is a USC Family Caregiver Resource Center, and the second is Alzheimer's Los Angeles. I would urge anyone, whether you feel overwhelmed or not yet, to reach out and know what's out there for you, because you're dealing with a situation that will progressively likely become more challenging. So the importance of getting a memory evaluation, it would be easy to say, why would I get a memory evaluation for my mom? Because we know the disease isn't going to go away. We already know, we can tell for sure that she might have it, and we know it's not going to go away. But there are some really important reasons to get a memory evaluation. And one is for you to optimize disease management, to manage coexisting conditions, to plan and coordinate care. Always good to get up ahead of a situation that you know is going to progress, to obtain drug and other non-pharmaceutical treatments, to definitely engage in a medication review, because as we know, people who are living with dementia oftentimes are very challenged with taking their medications. Sometimes they'll take 2 or 3 at a time, or they'll mix them all up in a bowl, which I've heard firsthand from a case manager. So medication review and how to manage it in a way that the person takes just what they're supposed to need and supposed to take and when. We had one person who was supposed to take all their medications with food. So they took their sleeping pill in the morning with their breakfast because that was the only meal they ate. So this kind of situation is certainly worth monitoring. Also, you want to ensure a safer environment for people who are living with dementia. As I mentioned, stairs are difficult. Striped flooring, the darker stripe looks like a hole. Loud noises, most certainly. There are many other home modifications that can best support someone who's living with dementia, and it's really worth understanding those and knowing those up front as soon as possible. And then you want to anticipate issues and head off crises. If you notice your mom's, well, she's starting to, or anyone is starting to maybe get agitated every afternoon, and same time they're getting agitated, which some people refer to as Sundowner Syndrome. Well, okay, they get agitated around 4 when the sun's going down. So maybe at 3:30, we're going to plan to give her her favorite candy bar, or we're going to go out for a ride in the car, or we're going to bring the dog in, something like that. So knowing there's a diagnosis will help you start planning all of these types of interventions so that'll make your job easier and their life better. So also participating in clinical studies is incredibly important because, as we know, the prevalence of the disease is extraordinary and we don't yet have a cure. And then receiving referrals to home and community-based services, which is also great. Also for the caregiver themselves, whether it be family or professional or it's good to have this diagnosis because you're also going to need support. So all that you're going to do for your family member, the person you're caring for, is you're going to have to do that for yourself, reaching out, finding where the caregiver support is, finding where you can get respite, so you can get a little break, finding other resources that'll support you and help you to understand and support you through the process. So lastly, as I noted earlier, my name is Jean Galliana, and here is my email address. Feel free to reach out to me for anything.
Thank you very much, Ms. Jean. It was just an eye-opener to be able to see and be able to read all these facts. A lot of things that we don't know. Obviously, when a diagnosis is first given, we have a lot of questions and we're new to everything and we need all the support groups that we can get. And we thank you for sharing your experience, your personal experience as well with us. It's very meaningful coming from somebody that lived it. Obviously, there are many reasons to be informed. Like you said, the abuse can come from different places. We were just interviewing a family whose mother lived in another state. So she didn't know that she was being a victim of negligence. She lived in California and she lived on the East Coast, her mother, until she was able to see with her own eyes what was happening. And she was able to bring her home here to California and care for her. So these are just many experiences, of situations that a lot of us are not aware of. And so it's very important to also be that reporter, like you said, like report when something is not right and we feel like there's something happening with our family members. Thank you, Ms. Galliana. We will actually have questions later on that you will be able to answer because some of our participants are asking questions for you, and we will share those later on as well. But for now, I would like to introduce Dr. Ralph Pascual. He works with LA County Adult Protective Services. Mr. Pascual has been with APS team for 21 years, with 8 years as a field social worker. He leads the LA County APS training program that recently won a 2002 National Association of Counties Award, recognizing, of course, innovative programs in the county, different counties in our state. So that's really a big deal for the team. Ralph is also an adjunct faculty at Pacific Oaks College, and he holds a PhD in gerontology. So Dr. Ralph Pascual, welcome. Thank you very much for being here with us.
Oops, great. I almost forgot to unmute myself. Thank you very much for that kind introduction, Sandra. I was just waiting for my screen to turn purple, but it's okay. All right. Like Jane, I also lived the experience of having a loved one who had dementia. My mom had vascular dementia. And I'm telling you, it really was a tough experience, but I would not exchange that experience for anything in the world. It's actually an honor to care for my mom. Anyways, I am presenting on APS, and I know there are also social workers in the webinar, and really thank you very much for joining us today. I just want to acknowledge the fact that they do have a very delicate task of balancing a client's right to self-determination with their task of protecting the client. I am honored and humbled that you are in attendance. So as far as APS is concerned, here in California, APS investigates elder and dependent adult abuse that occurs in the community. Abuse and neglect that occurs in nursing homes and other institutions are investigated by the Long-Term Care Ombudsman. In LA County, the Long-Term Care Ombudsman is administered by our partners from Wise and Healthy Aging. Elder abuse is really, in short, it's the mistreatment of an older person or a dependent adult. The abuse can be intentional or unintentional. The fact that the abuse happened is abuse. AB 135 came into effect this year. What AB 135 did is lowered the age for our elders and dependent adults. An elder is now defined as somebody who's 60 and over. A dependent adult is somebody who is between the ages of 18 and 59 with physical or mental limitations. Elder abuse can occur when social supports are not in place to keep us connected as we age. As you know, and many of the folks in this webinar know that isolation is a huge risk factor. Elder abuse can be prevented if we work together to create a stronger community that values and supports all of us as we age. From 2000 on, there has been a steady increase in APS cases. The only time that we saw a decline was in 2020, when COVID-19 shut down the whole world. Despite the consistent rise in the number of cases, according to the DA, 1 in 5 is still unreported. Next slide. I'm not sure if I'm seeing this next slide though. Are we on the next slide? Okay, I'm just going to list the types of abuse. As already Jean has mentioned, the types of abuse that we have physical abuse, which can also include sexual abuse. You have self-neglect or neglect, and you also have financial abuse. We also have psychological abuse, isolation, abandonment, and abduction. So next slide, please. What happens when a report is made to APS? After the report, each report is assigned to a social worker for investigation and case planning. The assigned social worker attempts to have a private face-to-face meeting with the victim within 10 calendar days of receiving that report. IR situations or immediate response situations are responded to within 2 to 4 hours of receiving a case. An IR situation means, or examples of an IR situation can be physical abuse or sexual abuse. It can also be somebody who is in danger of being evicted because maybe of an abusive relationship in the home, or somebody who might not have utilities, especially in the summer when it's too hot. It really might jeopardize the health of our clients. The reason why I say client is once an APS case is opened, they become our clients. And also within 24 hours of receiving the case, the social worker is actually required to contact the reporter within 24 hours of receiving the case. The reason for that is threefold, okay? First and foremost, they have to acknowledge the fact that the case has been received out of courtesy to the reporter. Secondly, obtain additional information such as potential hazards to the social worker. Folks, there have been so many instances when the social worker would go out and find out that there are guns in the house, you have rabid animals on the loose, and you have drug activity on the street. So again, the reason why APS social workers need to contact the reporter is just to obtain additional information. That will help the APS social worker in proceeding with the case. And the third reason is to educate the reporter in terms of confidentiality policies. Anything that the social worker investigates or pretty much gathered during the course of their investigation is confidential. I know APS is a public program, but our client records are not public. So those are the three reasons why the social worker needs to contact the reporter once they receive the case within 24 hours of receiving the case. Next slide, please. Oh, I'm sorry. Go to the previous slide. Oh, there you go. So what happens then once a report is made? Oh, I'm sorry. Yeah, please go ahead and next slide. I'm losing my my connection, that's why. Okay, are we on the next slide? I'm not seeing it though, I'm sorry, apologize.
Yes, you are, Doctor, you are.
Oh, okay. Yeah.
What apps cannot do.
Okay. Just debunking the myth, because there's so many misconceptions about APS and what we cannot do, is these are some of the things that we cannot do. Again, just because there's so many misconceptions about APS. We cannot remove a person from their home against their will. The thing is, the only reason we will be able to remove an individual from their home is if they are a danger to themselves or others. Even then, we do not do that ourselves. We rely on law enforcement or mental health to write the psych hold and put a hold on our individual or our clients. We cannot authorize or force a client to accept medical treatment. We cannot make the client bathe, take meds, see the doctor, or administer meds. We cannot authorize placement in a skilled nursing or any other facility. That is pretty much a responsibility of the attending physician. We cannot hire or fire IHSS providers. That is the responsibility. The only person that can actually do that is the client themselves, and we cannot transport our clients. What we can do is we can connect the client to services within the community so they can remain safely in their homes. That's the #1 goal of APS, is to make sure that the support systems in place for that client to remain safely in their homes. Next slide, please. Okay, in terms of, if you suspect that an elder dependent adult abuse, if you suspect that an elder or a dependent adult is a victim of abuse, please make sure that you report. In the community, in a private home setting, that case goes to APS, Adult Protective Services. In a licensed care facility, such as a nursing home or board care facility, that case is to be reported to the long-term care ombudsman. In an emergent situation, please call your local police or call 911. If you are not a mandated reporter, but a relative, a neighbor, or a friend of the victim, and if you've observed an elder or dependent adult being abused, only a phone call is necessary. You do not have to fill out any paperwork. You can, in fact, even report anonymously. You do not have to provide your information. Mandated reporters, on the other hand, they are to provide their contact information per state law. So all reporters need really is to have a reasonable suspicion. That's all you need to report to APS. And also we do have, I'm sorry, if you can just stay on that slide. I just want to point out the fact that we also have a web intake page for non-emergent reports. And I wish hopefully somebody can actually copy and paste it on the chat. So those folks who are in attendance, especially mandate reports, you can just copy and paste and bookmark the link. However, all reports that require an immediate response situation, okay, such as physical abuse, sexual abuse, no food, or again, somebody who might be in danger of homelessness, that still need to be reported or called to the elder abuse hotline. and you can email your SOC 341 to the email address on the slide. And this is again from our intake folks. I just want to put it out there that we ask that you please do not duplicate your reports. You do not need to report to the Elder Abuse Hotline and the web intake page. All you need to do is just do one or the other. And again, if in doubt, if you have questions, please make sure you call the APS to the line at that number on the slide, which is 888-202-4248. And I see that somebody actually put that on the chat, and thank you very much. And you can also always visit our homepage for more information. Next slide, please. Again, if you suspect the abuse allegedly took place in a long-term care facility, this is the Long-Term Care Ombudsman's phone number. You can always contact them. They do, in fact, also have a 24 hours hotline. Next slide, please. This is probably a good FYI for all mandated reports. Again, this applies for mandated reports, and I'm going to spend a little bit of time on here. Failure to report is a misdemeanor, punishable by not more than 6 months in county jail, or a fine by not more than $1,000, or both by imprisonment and fine. The willful failure to report causing death or great bodily injury to their clients is punishable up to a year in county jail, or by a fine up to $5,000, or by both imprisonment and fine. I'm not sure if we do have employees of financial institutions. I just want to make sure that they're aware that financial institutions are also mandate reporters of elder financial abuse and dependent adult abuse. Failure to report for financial abuse, for financial institutions is subject to a civil penalty not exceeding $1,000. The willful failure to report is subject to civil penalty not exceeding $5,000. The civil penalty shall be paid by the financial institution, which is the employer of the mandated report. For me, though, I think $5,000 is not enough, as many of our financial institutions have deep pockets. So that's just me soapboxing them. All right. So whenever 2 or more mandated reports suspect abuse, they can choose one person to make the report. But please make sure that whoever that chose to make the report actually make the report to APS. What if my supervisor doesn't want me to report? Well, as a mandated reporter, you are legally obligated to report abuse, even if your supervisor or administrator advises against it. Please remember that reporting is a personal responsibility. A mandated reporter who is acting in good faith is protected from criminal or civil penalties when reporting abuse, even if the investigation does not yield any evidence of abuse. And next slide, please. I love this quote from Albert Einstein, because this is pretty much the crux of APS work. I have reached an age when if someone tells me to wear socks, I don't have to. I love Einstein for that. So the bottom line is APS services are voluntary. The client has the right to self-determination. As long as we deem the client to have decisional ability, then the client's decision always comes first. There's a couple of caveats to self-determination. One is if it's obvious for the APS social worker that the client does not have capacity, the capacity assessment may be necessary. So that means they may have to be referred to a clinician for further assessment of the client's cognition. Please remember that APS documents behavior. We do not and cannot diagnose because we are not clinicians. Secondly, if a crime is committed against our client, then we do have the obligation to cross-report that or refer that to law enforcement for further investigation. Any abuse by others is automatically cross-referred for further investigation. Again, like I said earlier, APS has the delicate task of balancing the client's right to self-determination with the APS task of protecting the client. And I believe that's it for me, and thank you very much for having me.
Thank you very much, Dr. Ralph Pascual from the LA County Adult protective services, you shared something very, very important. We can't just turn our eye blind. We can't just let it go, or we can't, be intimidated. Like you said, if someone, our boss, for example, tells us not to report something, it's our duty, and we have to. One of our interviewees earlier in the week was telling us that caring for his father, like you said, caring for your family member, was an honor, because obviously this person gave him life, and to him it was not something, it was difficult, but it wasn't something that he would have not done for his family member. And therefore it meant so much to him to, look for the resources that are there for his loved one. And I think that's something that goes hand in hand with reporting on abuse. I know during the pandemic, you also mentioned that a lot of reports were not made because a lot of people were at home, just like it happened with children as well. They were not going to school. The reporters were not there to see these signs. And so now that everything is opening up little by little, medical services, I think it will definitely serve as a big eye opener to do our duty, to do what's right for these gentlemen and women that are out there, that are older, that are seniors, that cannot otherwise would report it for themselves or by themselves. So thank you very much, Dr. Ralph, for sharing this information with us. And another big component of this work that the agencies are doing has to do with the social worker, the documentation of these cases. And now I would like to introduce you to Ms. Amanda Huggins. She's a social worker with the Department of Workforce Development, Aging and Community Services. And she's been working in this job passionately for a few years now. She holds a master's degree in education with a focus on curriculum and instruction. And she's here with us to share some of her experiences and her knowledge in this field of social workers. How are you doing, Miss Amanda Higgins? Welcome.
I'm doing good. Thank you, Sandra, for having me. I just wanted to acknowledge, like Ralph said, it is an honor to be able to take care of an elder, especially one with dementia. It does get to be quite hard at times due to them not being able to either remember or have the capacity to at least give you the basic needs of their day. I did grow up with my grandmother with dementia, as well as my mom who recently passed. So it's kind of, this one's a lovely experience to be able to help others recognize abuse with those with dementia and elder. So with that, some tips and signs to recognize those that have dementia and are being abused is basically to recognize their difficulty with concentrating, planning, or problem solving. Some things you may think are simple that they just are not recognizing or remembering, but it does take, the simple steps for someone to recognize, especially as a social worker, to know the abilities are diminishing for them to be able to make the basic planning needs or to react to emergencies when they arise. Another one is language problems. They're not able to find the words like I'm doing now, or they're parroting the words that they are basically trying to say. They repeat themselves. It's a loop where you can try and refocus them, but then they go back to the same words over and over again. Another impairment that they have is memory, such as difficulties remembering events, remembering time and space where they are, things like that. There are times when you interview someone and you ask them the day of the week. And I get in COVID, it has been hard to remember the days, the weeks, the months, but to remember the basics of their birth date is a big one, considering they've had that birthday for their whole life. And most people are big on celebrating. Another thing that is also important to remember or to be able to recognize is them being confused in the location. I recently had a client where he called me from the hospital. I don't know how he remembered my number, but he called and he stated he didn't know where he was. He didn't know how long he was there, but he could recognize that it looked like it was a hospital. And then upon further interviewing or speaking with the nurses, they stated he had been there for at least a week, and kind of came in willingly. So the fact that he didn't remember was alarming to me. A big one to remember or to check is the change in mood. This one is a big one. When talking to a client, if the mood changes suddenly, if they are depressed, if their behavior changes, is a big one. If you're asking simple questions and you notice that they've now become angry at you asking them what you would think is a simple question is a sign of dementia and potentially being abused by others, especially if you're asking them about the abuser themselves. Another item is finishing daily tasks. I know we all have that problem. At least I have the problem of finishing daily tasks, especially as a mother. Everything seems to kind of run together, but there are times when you can definitely see when a client is not able to finish the basic task of tying their shoes, putting on shirts, the buttons being buttoned wrong, and things of that nature. At times when you, as a social worker, at times when you go to visit the client, they're going to be some point where it's uncomfortable to have that conversation with the client, especially with them not understanding that they have dementia. A lot of people don't recognize or don't want to admit that they've lost memory or going through it. When you're speaking with them, one of the best things to do is to keep it comfortable, keep it casual, let them know that you are there for them, that they are, just you're there to offer support. You want to continue and allow them to speak. Don't monopolize the time, don't monopolize the conversation itself. You want to listen to respond. Well, you want to listen to receive, not listen to respond. Allow them to give their opinion. Don't make suggestions or don't allow your opinion to influence the situation. Ask them what their opinion is of the situation. Make sure you understand. And if you need clarification, go back and ask for more input. Value the input that they are giving you. Praise them, because at times as a social worker, there's going to be a lot of times where they do not want to open that door, let alone take the phone call or allow you in. So the fact that they've opened the door and allowed you into their private space to answer these hard questions, acknowledge that and let them know, thank you for opening the door. And again, you're here for support. There are going to be many times, especially with working with elder and dementia patients, where it seems to be frustrating. One, because you are trying to seek answers that maybe they don't remember or even are not able to comprehend or relay to you. In those situations, it's a must. You have to stay calm and just redirect the conversation when need be to bring them back to the situation at hand so that you're able to get the answers needed for the current situation. When in doubt of potential elder abuse, there's many things as a social worker, as a mandated reporter, as a friend or family member that you can do in regards to either filing the abuse or at least acknowledging and seeking for help. You can seek help through other family members. You can use collaterals, and you can also speak with the attendees of medical staff. If you feel that it is abuse, it doesn't hurt to call a friend, call a family. Hey, you know, I heard this. I don't know if it's abuse. Maybe you can help me, you know, just to hear some feedback on how to approach it is the difference. Also review medications and prescriptions, confirm the diagnosis as well as the dosage that is required for a client to have. As stated earlier, there are times where with dementia, they are confused and don't understand which pills they need to take or medication they need to take. And it's best to go over that and maybe set up a schedule with your client or with the client so that they can understand and have times at when they need to take their medication. We also offer, well, not we, but there is cognitive testing that can be given to dementia patients where it tests their memory, problem solving, attention, counting, as well as their language. That is something big that goes with clients, is their ability to speak. So that would be a good test to look into. And then when in doubt, as a social worker, we do have the Forensic Center where you are able to speak with a panel of multidisciplinary team where they can actually assist. The team is made up of medical providers, legal, police, mental health, and public guardian, where everyone kind of comes together on the different cases and they're able to recommend what's needed or what's next for the client. Thank you for the time, Sandra. There's my information. If you guys have questions or concerns, I'm free for questions after.
Thank you very much, Ms. Amanda Huggins, social worker and amazing woman, giving us some of her valuable time to educate us more on what we should know about our seniors or their well-being to prevent abuse, of course, what to look forward to if you know, they're going into a new home or if they're just entering a senior center. We just have to make sure that they're well taken care of. And obviously those are some of the signs that Ms. Amanda Huggins shared with us. I would like you to take a minute, if you can, please participate in our other question for our poll. And this one has a couple of questions. This one is on a scale from 1 to 5. I feel like I know more about elder abuse. 5 being you strongly agree, 4 being you agree, 3 neither agree nor disagree, 2 disagree, and 1 strongly disagree. So if you feel like you know more about elder abuse, if you can pick one of these questions, it will be part of our poll. And well, I will give you a chance to participate and pick one of these. And then if we can go, there's a second question, if I'm not mistaken, which has to do with dementia. I think maybe we're going to go to that one next. The next one is on a scale from 1 to 5. I think we're getting ready to put it up there. I feel that I know more about how someone with dementia might be at risk for elder abuse. So on a scale from 1 to 5, I feel that I know more about how someone with dementia might be at risk for elder abuse. Obviously, we've had a very important presentation today, informative presentation from our panelists and experts that have shared with us some of those signs and the actions to take. And that is one of our poll questions. We have questions that some of you have asked to our panelists, and we would also like to answer some of those, quite a few questions actually. And how about if we start with this question that Ms. Lawanda is asking to one of our panelists. She is saying, my mom was tested by one doctor who said she definitely has dementia and another who said it was depression and stress. Can dementia go away? If we can have one of our panelists answer that question, that would be great. Maybe Ms. Jean Galliana, would you like to answer that question for Ms. Lawanda?
Sure. Yeah, so it's interesting. Just overall, I would recommend getting another opinion because there are tests out there that are very specific to dementia and very different from depression, like the mini mental. I know our Dr. Trejo is an expert on mini mental, but there are also other tests like drawing a clock and simple other tests that will differentiate dementia from depression. But also we should note that very often dementia is diagnosed in people who have UTIs. UTIs can, urinary tract infections, can cause an incredible amount of delusion, and it's kind of surprising. I have a friend who's in her 80s, and one day she called me. I was living on the East Coast, and she lives here, and she called me and was saying all these things that sounded so odd. And I reached out to my brother, who's a physician, and he said she needs to go to the emergency room. She has a severe UTI. But those instances, she was thinking that she might be pregnant. She was in her 80s. So those things could easily say, oh my gosh, the person has dementia. Why are they saying that? Well, actually, it could just be that. It could be someone could display components of dementia, maybe from medication mismanagement. So it's definitely worth getting a second opinion. And if the person has been in the hospital, there's a very big issue that people don't talk enough about called hospital-induced delirium. And sometimes when older adults get into the hospital, they get so disoriented and they're in such an odd situation that they become delirious. And oftentimes could be diagnosed with dementia when in fact they don't have it. And for older adults who do experience hospital-induced dementia, if they don't have already cognitive decline, when they get out of the hospital, they'll recover. They're likely to recover fully. If they already are in cognitive decline, that further decline oftentimes is you can't take it back when you leave. So another reason to avoid the hospital, but certainly I'd get a second opinion on the dementia diagnosis.
Well, Ms. Jean, follow up from Ms. Lawanda. She mentions that her mother had a stroke and has a brain hemorrhage. So she definitely has cognitive decline. She tested 14 to 30 on the dementia test.
It seems to me that I'm not a doctor, but it really seems like your mother may have dementia that was induced by a stroke. Dementia can be induced by other things rather than just correlated with aging, like overuse of alcohol or a head injury. But I certainly would reach back out to your doctor, and I'd reach out to the Alzheimer's Association of Los Angeles to get some support and feedback from them.
Very well. Thank you very much, Ms. Jean. A question from Ms. Diana to the panelists. She says, in the case of an APS report being made by a support as VCS care manager, if they suspect, observe, are told that a senior is being abused by family members living in their own home, and one of those relatives has minor children also in the senior's home, does APS also reach out to CPS on behalf of that child?
Is that question for me?
Mr. Ralph, definitely. If you would like to answer, that would be great.
I cannot start my video though, so I'm sorry. Yeah, because it says on here.
No problem. We can hear you.
Okay, here it is. Start my video. There you go. The thing is though, if there are minors in the home, the APS social worker is mandated to report that to DCFS. So yes, yeah, it's not uncommon to actually find minors also in home, mainly because again, you have more and more households that are intergenerational. So yes. So to the short question, the short answer to that response is yes.
Thank you very much, Dr. Ralph. We go to the next question, and it says, okay, that is the same question that Mr. Ralph just answered to us. And this is a question for Ms. Jean from Cynthia. It says, my mom was tested, well, Ms. Cynthia sent it to us. My mom was tested by one doctor who said she has dementia. Another physician stated it was depression. And you just mentioned that if we need to get another opinion, we should, right? And that was basically the dementia, can dementia go away? So thank you very much, Dr. Jean. I mean, Ms. Jean, you answered that question as well. And this is for Ms. Jean too. I have a family member who exhibits signs of dementia, but he refuses to get a checkup and he refuses any kind of advice and help. We clearly see he isn't doing well. What kind of steps can I take towards assisting him? Ms. Jean.
Well, that's incredibly common, like very, very common. So you're certainly not alone, nor is your dad. People do not like to have their deficits on display. And denial is a big coping mechanism when you're losing control of your life and your memories and your function. So you're totally not alone. And there are two things that I would recommend. One, I would recommend reaching out to the Caregiver Support Center at USC or to Alzheimer's Los Angeles, because they can guide you through this challenge because they see it all the time. And you also are going to need support for yourself because this is extremely challenging for you. And you're in it for the long haul, and it could be a long journey. So you can't burn yourself out right up in the front. If at all possible, I would seek support. Yeah, and getting someone tested, I don't know if I would tell them it was a test for dementia. We took my mom in to get tested, and it did not go well at all because there's one question after another that they're not able to answer, and it's very, very frustrating for them. So if you do that, if there's anything that you could give your dad that could calm him a little before, but not interrupt his cognitive function in the way that it works. And certainly, I mean, I had a fun lunch planned at her favorite place, which was down the street from where we were going. And, you know, that was halted the minute she got out of the appointment. But if you could plan something fun, or at least try to have something fun so that the thoughts are not on that exam the minute they get out of the room. Let's go have pizza, or let's go to your favorite beach, or let's go watch the airplanes at the airport, or something like that. I would really try to bookend that exam with that. And I mean, I know you're supposed to be honest with people who are living with dementia, but you could tell them all day that they have dementia and they're going to say they don't. So there may be creative conversations around changes that you're making and why.
Creative conversations. That is definitely a situation we don't all are prepared for to confront. And so that is definitely a way to do it. Ms. Jean, thank you very much. Dr. Pascual, what California law lowered the age for elder abuse to 60 years old? Someone is asking from our audience.
I responded to that as well. It's AB 135. That became effective this year. Yeah, it also lowered the age for the dependent adult, which is now 18 to 59, whereas before it's 18 to 64 with mental and mental and cognitive impairment.
Very well, thank you, doctor. Another question for Ms. Jean. Is there, or anyone in the panel that can answer this for us, is there a free or low income agency that would help with seniors that have hoarding issues?
I'm happy to start with that. We have an incredible resource here in Los Angeles called Genesis, and they serve older adults in the community. It's a, I believe, DMH program. I will put the link into the chat after. I would really try to reach out to Genesis for that. And I believe there are other organizations that will come out and help, certainly because it's a homelessness prevention intervention. Also, people get kicked out of their housing for homeless or for hoarding. So I know some of our prevention programs will provide hoarding relief just so that the person doesn't get evicted. And I see other people are on, so I'll let other people continue with this answer. Maybe Amanda.
Yes, ma'am. So another resource would be IHSS. The client would have to qualify for the services, assuming, well, I haven't had to do it in the beginning, but I did reach out to an IHSS social worker who stated that the client was in the process of receiving services, and they were going to send out a crew to assist with the hoarding and cleaning services. So that would be through the medical side as well.
Very important to know. Thank you very much. I know we've seen some cases in the news recently as well. A hoarding case, a home just here in the Southern California neighborhood. And a lot of people don't realize that that person needs help, and assistance was given to that resident in particular. And but to the neighbors, it was not only a danger for that person, but also for obviously some of the families that passed by that sidewalk that was already being just overcrowded with some of the stuff. So thank you very much. Ms. Amanda, now that I have you, this is another question for you. It says, can you explain what collaterals are?
So collaterals are basically those that know the situation better. Like I stated, family members are one. You can also consult with friends. As a social worker, we tend to go with our coworkers or our supervisors, our buddy supervisors. And then you also have the medical staff, whether it be the nurse, their doctor, or the supporting team behind them, as far as different collaterals goes.
Very well. Thank you very much, Ms. Amanda. Colleen, thanks everyone for this great presentation. And she says, I did not know about the forensic team as a resource. If anyone would like to explain a little more about that or expand on that.
Yes, ma'am. Uh-oh.
Go ahead, Amanda, go ahead.
So as far as the forensic team goes, that one is more for the APS side. We do have the team behind us that is we're able to take difficult cases to them and present the case as a whole. Again, on the team, they do have the medical, legal, police, and mental health, as well as public guardianship. So we come together now because of COVID on Zoom and basically spitball and try and figure out how to help the client or the client with dementia or whatever situation they're going through.
And let me just add to that as well. Literally, it is a table where APS social workers table their most difficult and most challenging cases. I just want to highlight the fact that APS social workers do not work in a vacuum. I mean, they work in a multidisciplinary team setting. That's correct, Amanda, right? So yeah, that's the purpose of the Forensic Center, and it's a great resource for APS social workers. Yes.
Very well. Thank you very much. Thank you all very much. It was a pleasure to be here and to be able to share some of the information with our audience from Telemundo 52, but obviously from our Facebook friends that have joined us. Thank you, obviously the LA County Department of Workforce Development, Aging and Community Services, LA Found, that has made a huge difference in the lives of family members whose loved ones, had situations where they would leave their home and they were not found for hours. We don't even want to imagine the worry that they experience. So LA Found is also another tool that is very useful for our families. We do have one more question. We just keep getting all these questions and we're so happy because obviously our experts are here to answer them. I would like to bring this up to you, panel. This says, where can we refer clients if they're having trouble paying for utilities and are at risk of losing their basic needs, such as food, electricity, water, etc.?
So I just posted in the chat that possibly those clients would be eligible for HomeSafe because if they are struggling that hard, they may be eligible for HomeSafe. They certainly meet part of the eligibility. The other part of the eligibility would be they need to have an open APS case. So it would be very possible that these type of clients are engaged in self-neglect and therefore would be eligible. So I would certainly look into HomeSafe, and I put that link in the chat. And you're welcome to reach out to me directly at LASA, and I can help walk you through that process.
If they are not an APS client, they can also reach out to 211 to see if there are other resources available for them to get assistance as well.
And just to add to that as well, APS social workers also have the ability to actually work with utility companies to maybe the utility companies can actually work with the client in probably, I don't know, maybe establishing a payment plan or in some cases, postponing the payment. So yes, APS social workers have the ability to work with utility companies.
Very well. And I know there's many services, food pantries as well, that are during the pandemic have become such a great, important service for our families that are not able to buy their groceries. Some of them are being able to receive them at home as well. So that's always a big, big help. We have a few more questions in this World Elder Abuse Awareness Day, by the way. This forum could not have come in a better time. This question is for Mr. Ralph, Dr. Ralph. There are times the individual starts to disclose concerns about care at home, but states, I don't want my daughter to get in trouble. Thoughts on next step?
We get that a lot. First and foremost, if the APS social worker actually suspects that there is a crime that was committed against the client, the social worker is obligated to make the report to law enforcement for further investigation. Yes, we go by the client's self-determination. Yes, they can. Our clients can, pretty much. Sometimes we don't agree with their decisions because it can even, endanger them further. But we still have to actually take the clients. We still have to honor the wishes of our client. However, like I said, if there is a crime that we suspect that was committed against our client, we have no choice but to make the report to law enforcement.
Yes, definitely. Thank you, Doctor. There are a couple of more questions. What's the best way for service providers to make a referral for their clients with dementia or their caregivers to access supportive services? Ms. Jean, is that something you would like to answer?
Absolutely. And let me just refresh. The question was about how
yes, what's the best way for service providers to make a referral for their clients with dementia or their caregivers to access supportive services?
Well, there are many. I certainly would reach out to the Caregiver Resource Center at USC because they have it all at their fingertips and it's what they deal with all day, every day. And the same with Alzheimer's Los Angeles. They're another incredibly passionate and very, very knowledgeable group of people who can direct you to every single possible resource with compassion and understanding.
To also add, if depending on who their provider is, if they're with the geriatrics program, they also offer support through their geriatrics department.
Very well, thank you very much. Another question that's coming into our chat, are mandated reporters the only ones required to report abuse?
No, if you we're required, sorry, Ralph, we are required to or mandated to report it, but it should be reported if you know it. See something, say something, right? It's that easy. If it were you in the situation, you would, and you genuinely wanted help, you would want someone else to reach out on your behalf, especially if you aren't able to.
Qualify Amanda's statement. Anybody can make a report to APS, and we welcome those reports. Like I said earlier, you are the eyes and ears of APS, because a lot of these cases take place in behind closed doors. So for mandate reports, though, because they're mandated by law, yes, they have to make the report, because otherwise, like I mentioned earlier, there are penalties for not making a report to APS. Whereas non-mandate reports, these are community members who are pretty much genuinely are concerned for the safety and well-being of their, let's say, their neighbors or friends. They can make the report to APS. They can always do, and they can always make the reports anonymously to APS. It really is more from our obligation for the non-mandate reports. It's not a legal mandate for them.
I want to jump in on what Ralph was saying. So many people, surprisingly, as I've learned, are afraid of APS. They think that people are going to show up in big police uniforms with guns and all kinds of toughness and whatnot. And actually, they're incredibly compassionate carers. They're fully educated and trained in understanding the needs and the vulnerabilities of older adults. So they come in with an open and a kind heart there to serve and support.
And I to add what Jean was saying, thank you for pointing that out, because the thing is, the misconception is that we come there to be punitive. In many of these cases, especially neglect by the caregiver, in many of these cases, then the caregiver just does not know that there are resources available to them. They're probably just pretty much as stressed as anyone else providing care for somebody who has dementia. But we're there to actually provide support and connect the caregiver, in this case, to resources. If anything though, like I mentioned earlier, I think I mentioned this, is that the bottom line for APS is that we are trying to make sure that the client remains safely in their home. And that entails building the support system. So yes, we're not there to be punitive in many of these cases. We're there to help.
Very well, thank you all. I know there was a few notes here in the chat. If a client is experiencing food insecurity, Meals on Wheels could be a fabulous resource along with food pantries. We were just speaking about that. One last question, does the Elder Abuse Hotline support other languages, for example, Spanish?
Yes, we do have the capability. We have a multilingual staff. So yeah. And if we don't have that language, we do have the language line that we can always use as a resource. Yes.
Thank you. Going back to the nutrition, the elderly nutrition program offered through our partners area agency on aging within our department is also a great resource for home delivered meals. Those are some of the tools that are there available for our community as far as nutrition. So thank you all very much. This has been a wonderful forum in which we all have learned a lot about the care for our seniors. And we would like to let you know that there's many other ways that you can benefit from this forum and the experts. You can also send us some of the questions that you might have in the LA-Found at wdacs.lacounty.gov. It will also go in our chat, so you can ask the experts and the department some of the questions that you might have later on if you were not able to ask them here in the forum. You also are asked to check your email. Your resources might be there mentioned in this presentation along with the presentation slides. And if you would like to see this presentation again, the recording in the Facebook of LA-Found, you will find it also on Instagram, Twitter, and other platforms for social media that will be available as well. And we would like to thank all the participants. Of course, I thank Cynthia Mattia for allowing me to be part of this, and Ms. Laura Trejo, Dr. Trejo, thank you very much. Dr. Ralph, Ms. Jean, and of course, Amanda, thank you for being part of this and for informing us and keeping us aware of everything that's available for our seniors. On behalf of Telemundo 52, I would like to thank you, remind you that tomorrow in our morning show at 6 a.m. in Tu Vecindario, we will have one of the reports regarding the services that LA County is offering for our families in need, the Latino families. And at 11 a.m., we will have the Spanish version of this wonderful seminar. So I thank you, and I hope we can see some of you tomorrow as well for the Spanish version. Thank you. Thank you, everybody. It has been a pleasure to be here with you today.